Kia ora and welcome to the NZHIA's 9th episode in the hemp webinar series for July 2020. Today we're going to be discussing health, which is one of our pillars, along with food fibre. So back to health, medical cannabis scheme, THC and CBD. So today, as our presenters, we have joining us Manu Caddie from the Medicinal Cannabis Council, Tara Creaven, who is an independent regulatory consultant, and Mark Lucas from Cannasouth. So we're really looking forward to their presentations. And without further ado, I'll hand over to Manu to get us started. Welcome, Manu. Manu, are you there?
Kia ora, Richard. I'm not sure how great my internet is today, so wave a hand if I bug out. But kia ora, everybody. I just was asked to share a bit about the New Zealand Medical Cannabis Council. So hopefully this is working.
Perfect.
So yeah, we were set up in 2018 with 4 companies initially: Cannasouth, Liga, Hukarangi Cannabis Company that's now Rua Bioscience, and Zcan, and have been joined by a number of other members. And so similar to NZHIA, we are the Medicinal Cannabis Industry Association for New Zealand. These were the 4 objectives we started out with, really around cooperation in the sector, and at the time making sure that we had really good regulations being developed, and so contributing to that process. And yeah, just generally sort of building a reputation of the sector, given that it was and still is so new. And I'm not sure if this list is totally up to date with our associate members, but we've certainly been growing. There's about 30 organisations involved now, including our first international member, and yeah, most of the licensed companies in New Zealand, and there's a few that aren't on here that we're in discussions with who will be coming in shortly. So the board at the moment, myself, Michael Moore and Shane LeBrun and Tom Hooker. Sally King's our very part-time paid employee who yeah, does a lot for us, well above what we're able to pay her at the moment, given none of us have yeah, commercial licenses or only just got them. We're structured around some projects and committees. So Nigel, who's speaking on Thursday, leads our standards and technical committee, and that's mostly the labs, very focused on yeah, technical standards and looking into regulations, and I'll talk a bit more about that shortly. We've got a government relations committee, which at the moment is really a committee of the whole in terms of our full members all participate in the monthly meeting that we have for the Ministry of Health. And we've also yet to progress it very far, but a workforce development committee with Angela from Nature's Answer. We also have a prescriber education project that Dr. Elizabeth Plant from Equalis has been leading, yeah, really trying to look at how we're going to build the competence and confidence of prescribers in the country to prescribe the products that we're producing or importing. Shane LeBrun has been fronting our efforts to have CBD reclassified, and we had another consultant called Natalie Gould, who's worked a lot. She was on the Medicines Classification Committee and has done quite a bit of work on that for us. So far we haven't been successful, but yeah, more work to be done there. And Chris Fowley headed up our efforts around the referendum, and recently we surveyed our members, as I see NZHIA are doing, and we've got the results from that we'll be sharing with our members shortly. Needless to say, as a member-based organisation, we won't take a position on a yes or no on the referendum, but have some other commentary to contribute to the national discussion. These are really our priorities as an association, that cooperation amongst the sector to begin with. There's lots of things that we can have done already together. And one of those was overseeing or sort of having real input into the regulations as they were developed. Market access is a big one in terms of the New Zealand market, and as I say, convincing prescribers, making sure that patients within the limits of the Medicines Act can understand what the rules are, or what the products are, and that we're playing by those rules. And also overseas markets. New Zealand ultimately is a very small market, and making pharmaceuticals is a very expensive exercise. So gaining opportunities to export is really important for our sector. As I say, prescriber education, CBD reclassification, technical standards, workforce development, and a little bit of contribution to the global cannabis policy debate and development, mostly through MFAT, New Zealand Ministry of Foreign Affairs and Trade, who participate in those forums. So yeah, industry cooperation, looking at a range of opportunities there, and yeah, just getting together as much as we can, communicating, and making sure we are informing our members and keeping those communication channels as open as possible. Legislation, regulations, also interested in the things like the review of the Medicines Act and the Therapeutic Products Bill that may be introduced this year. Doesn't look like it. Natural Health Products Bill is being reinvigorated. Got to the third reading in 2017 before New Zealand first scuttled that, but we see some big opportunities for CBD in there, and so keen to cooperate with others pushing that along. And also things like the Plant Varieties Act, which has just been reviewed, and obviously hemp regulations have some minor impact on the sector, and talk about that. Prescriber education, working with medical professional bodies, academics, and the new agency, which unfortunately missed out on budget bid to fund some independent prescriber education. So just looking at how the industry might be able to support that without putting our logos all over everything. But the goal is really that patients and prescribers in their organisations understand the range of medicinal cannabis products and indications and contraindications that they need to know as prescribers, which just will increase the confidence, hopefully. Shane's work in CBD reclassification and MedSafe, Chris James has been very motivated to see if there's something we can do here. The only caveat being that he doesn't want to undermine the whole medicines regime. So it is a challenge here, but we're looking very closely at what's happening in Australia with CBD reclassification being led by the TGA over there. As I say, also looking to the review of the Medicines Act as the Therapeutics Products Bill comes to draft form, and potentially the Natural Health Products Bill will move faster than the therapeutic products in other jurisdictions as well. So continuing that effort, and have been having good discussions with NZHIA around opportunities to work together on some of that. Nigel can talk a bit more about this if anyone's interested, but looking at a range of issues around technical standards, those analytical method developments, and standardisation across labs and across companies, and also getting some New Zealand labs GMP certified is important from our perspective, and it's great to see rapid progress in that regard, and also some very technical discussions around ingredients, regulations. So yeah, lots of complicated stuff that goes on in that, but it's a well-attended committee, and Nigel's done a great job to date of progressing some stuff and putting it back to the ministry for some clear responses. Workforce development, probably keen to collaborate again with the hemp industry on this, just looking at career pathways, qualifications, working with training providers, TEC. We also get questions around health and safety, and unions and worker protection will be stuff that becomes more popular and important as the industry develops. And yeah, as I say, touching on the global policy situation, which is well out of date, and which New Zealand has recently been taking a more progressive and proactive stance on in these international forums. So it's good to see. And the referendum obviously will have a significant impact on New Zealand's standing in the global community. Canada's a bit of a pariah since legalisation, and we can expect similar repercussions, I think, if it goes ahead here, but there's also opportunities there to progress those discussions faster. We've been working on an industry development plan and some priorities that the members will be working through over the coming month. And these are our sort of draft list at present that the board's been pulling together. And yeah, probably no surprises in there, but great to see Callaghan Innovation have finalised their roadmap, capability roadmap that we, as an industry association, had some input into along with government agencies, and it'll be great to get that out to new entrants to the market who want to look at where they can play in the industry, whether they want to be vertically integrated across everything or whether it's just one part of the value chain that they want to participate in. Great too to have people like Tara who have expertise and can contribute to licensing questions and so forth. This is the main sort of portal that's in the roadmap, and you click on these areas and it goes into more and more sort of layers and depth around the expertise and also each part of the value chain. So again, I think there is opportunities for hemp producers. I know our company is talking to some cultivators about outdoor cultivation, and yeah, plenty of medicinal cannabis license holders have started with a hemp license, and that seems to be a good pathway for those that want to get into medicinal to start with. So I'll probably just stop there and happy to answer questions later on.
Okay, Manu, thank you very much for that. That was a quick deep dive into the medicinal cannabis industry in New Zealand. Good to see you've got such great representation from all the companies involved as well. It's really important that people get behind their associations, because that's the thin edge of the wedge and can be really useful when talking to regulatory bodies. In the value chain, back to the Callaghan Innovation, the roadmaps have done a wonderful job there. And I think that the fact that there'll be growing documents will grow with the industry as well. So there'll be a huge resource in time, because as you've said, Manu, people are working out their role in the value chain, whether it be vertically integrated or just as a part of the whole process. So very, very cool. And we'll, as you say, come back to you for some questions. But from there, we'll just jump into a little bit of the licensing process and et cetera with Tara. So Tara, if I could introduce you and encourage you to come on board and give us your presentation, please.
Okay, can you hear me?
Can hear you, yes.
Okay, let's get the screen share going. Just bear with me for a sec.
You're on your way, yeah.
Yeah, can you see that?
Yeah, you just need to blow it up into the...
I will.
Yeah.
On its way. There. Okay, and I'm just going to try to turn on the video link. I lose quite a bit of stability with video link, but if you just bear with me for a sec, I'll try. And if the integrity breaks, just let me know and I can switch off the video link once we get started, okay?
Okay, thank you, Tara.
Okay, hi everyone. And now back to full screen. Okay, can everyone see that okay?
Yep, that looks good.
Okay, all right, well, thanks Richard and for inviting me here. I'm going to, and thanks Manu for the introduction as well. It's good to see all the great work that you're doing with the council. Really, really an important body of work. Richard asked me to speak today on the licensing process. And given that that's my, I suppose, primary area of interest in the medicinal cannabis sector, I'm given the time limits, I'm only going to be able to give you a quick, very sort of high-level view of the world. So that's going to be the scope of my conversation today with you. But at the end, I'll give you my contact information. If you have any questions, please feel free to reach out to me and we can take it offline. Or if we have time at the end too, I can try to answer some of your questions. So that's the subject I'm speaking today on. As I said, my name is Tara and I am the founder, director of Caduceus Medical Development, which is a consulting firm here in New Zealand. I'm based in Auckland. So I'll talk a little bit about the actual regulation. I won't jump into any of the details around the scheme or anything. As you probably know, this regulatory framework was rolled out April 2020 of this year after years of working in the background. Both Manu and I were on the advisory group to the Ministry of Health. So we're quite pleased with the result. Obviously, we're living in the house now, if you will. We designed it, we built it, and now we're living in it. There's no such thing as a perfect regulatory environment, but I feel at least it's a good place to be. And I feel that here in New Zealand, we are on the precipice of leading the sector. There are some challenges, as you can imagine, but I think overall the scheme is working quite well. And as I said, we are learning as we go. So as you're aware, the Medicinal Cannabis Agency is the regulatory body that oversees the medicinal cannabis regulation. And the type of medicinal cannabis license that you have to apply for will depend on your commercial objectives. So the next few slides are going to address what the different types or activities, as they're being called, under the MCL medicinal cannabis license. As mentioned, it depends on the commercial objectives. So for example, if you're a cultivator as an individual or as a business entity, you have certain obligations to fulfill in terms of documentation, demonstrating that you are that you can support commercially a medicinal cannabis license activity. There's quite a lot of responsibility around dealing with cannabis-based products, specifically around the higher THC, we haven't actually touched, sorry, I should back up. We haven't actually touched on the definition of CBD versus non-CBD products. CBD products are when we have the less than 2% THC, and then the higher CBD products, which are considered higher risk, have greater than 2% THC. So depending on the type of cultivar or the type of products you want to import, or the type of seeds if you're in the seed merchant business, or the type of products you want to research, will all depend on the type of product and therefore the type of license that you'll have to get. So I'm going to touch very lightly on these types of licenses or these license activities. The first one, cultivation, I think is pretty self-explanatory. If you want to get into the business of cultivating or growing medicinal cannabis plants, you will be required to apply for a medicinal cannabis license with a cultivation activity attached to that overall license. We can, as I said, get into more detail if you wish to speak offline. The nursery activity, as I mentioned, is around seed merchants only, quite limited in scope. And you, again, it's quite limited. And I know there was quite a bit of confusion at the beginning, specifically when some of the questions came towards me around who would have to apply for a nursery activity. If I have a cultivation license, do I need to apply for a nursery license? And the answer is no. If you have a cultivation license, your nursery license, you don't need to get a nursery license. It'll all be captured under cultivation. The research license is strictly to clinical trial research. It does not include benchtop research. It's only if we want to go to humans. So again, it's quite a limited focus. The possess to manufacture is probably the broadest focus in my experience. It covers any manufacturers who wish to get into GMP manufacturing. The possess to manufacture. It also covers those entities who are not maybe in the commercial space yet, who are doing some research and development, whether they're doing process development, product development, formulation development, just learning in general. You do not necessarily have to be selling these products commercially to have to apply for a possess to manufacture activity. And then the last license is around supply, the supply activity. This is strictly for importing finished products. There are different, again, depending on whether you're a CBD, your product meets the definition of CBD, or if it goes beyond into that higher, greater than 2% THC, you will have different requirements around an additional license if you need it, around importing. If your product, you'll need to apply for an import license if your product is contains greater than 2% THC. But otherwise, it's strictly a supply activity license. I thought I'll see if this link works. Richard had asked me to maybe navigate a little bit on the Ministry of Health website. So I'll check to see if this link works, and if not, I'll just go off my desktop. But let's have a go, and I'll show you. Let me see, can everybody see this? Richard, can you see my screen there?
So you have to probably share your screen to the web browser.
Okay, just a second.
So you'll stop that one and restart.
Stop share. Let's see if I can restart. Share screen. Yeah, it's not letting me. Try it again. Here we go. Share.
You're there. Well done.
Did it. Okay. So I thought it might be interesting just to show you a little bit around what the Ministry of Health website looks like. It's fairly comprehensive and it's updated regularly. I think that's the most important thing. So keep checking back on the website. You can also sign up for updates. This information here, subscribe for updates. Just enter your information and you can stay abreast of what's actually happening. So I addressed with you this license activities, cultivation, nursery, research, possessor, manufacture, and supply. And if we click on each individual link, you're actually going to see the scope of each activity. And it gives more detail around importation, illicit seeds and plants activities. If you want to supply seeds or plant material to another manufacturer or cultivator. Yeah, so I think it's really just to orient you a little bit around what types of activities and what sort of information is on the website. So this is the first part of my talk here, this license activity. And the next part will be around applying for a license. So again, we can click back into this, but just for convenience, rather than me having got to share another screen again, this is another location which I find very helpful. And as I keep going back to your, keep going back here for updates, you can understand what you need to do before you apply, what happens, the fees, and all the eligibility requirements. And I'm going to touch on this at a high level in my presentation, but I thought it was important that we actually show you, for navigation purposes, that this is where a lot of the information, I go in every morning and check to see what's new. It's the only way I stay current. Otherwise, it's constantly changing. So I'm going to go back to screen share. Okay. It's not working too well. Sorry.
No, that looks all right. Sorry.
Oh, does it look okay?
Yep,
okay.
That was okay.
That was okay. Desktop 2, share. Okay. Can you see that?
You're away. Yep.
Your picture was looking at me, Richard. All right. So let me just get out of this one. So just some tips before you actually decide what you want to apply for a license. The first part is read very thoroughly this part 4 of the guideline. Everything is in there. Everything, absolutely everything you need to know. And it breaks it down into the format of the medicinal cannabis license. So there's a high level overarching document called Section A, Form A, Section A. And that actually is the general requirements for all medicinal cannabis license applications. So if you're an applicant, whether you're an individual or a business entity, everyone needs to complete Section A. So that's this part 4 of the guideline tells you all the information that you need to meet all the requirements, all the data requirements. And we'll go into that a little bit more in the following slides. And the other part that I find extremely useful, a lot of the time I deliver a regulatory strategy for some of the clients, some of the people who are interested, and that lets them know immediately what those requirements are, which I know they find helpful. It kind of gives you that landscape, if you will, and it can be quite complex if you haven't done this before. As Manu mentioned, I've been working in regulatory in pharmaceutical drugs and medical devices, etc., for many years. So I have a good understanding of the value around laying out that framework for a business. It doesn't mean you have to do everything now, but at least it helps you understand. So part 4 of the guideline, if you read that, it's really good bedtime reading. If you feel like you need to have a good night's sleep, I think it definitely will give you all the information you need. The most important part I find is what's undervalued or underestimated is the amount of security that has to be, that infrastructure that new starters, new individuals or business entities have to invest in confirming that these products will maintain their security over the course of the operations. So again, there's an investment there that needs to be considered when you're budgeting and planning for the business. With respect to the actual license itself, first part is to read it. The next part is you really have to follow it in detail. My experience with the agency is that they require each applicant to complete the relevant sections of the forms that apply to the activity you're applying for. So you make sure that the guideline is one part, the form is the other. What I've realized is that the form it's not just filling a form, there's additional information that's being requested in the guideline. So that's very important. Just completing a form doesn't mean you're going to submit a complete application, and it's really important on that 3rd bullet point here is that the actual application has to be complete. And again, meeting all the requirements. Otherwise, what you risk doing is you end up having the application kicked back to you by the Ministry of Health in the first few weeks of their application. And in order to receive, if everything goes well, the Ministry of Health are estimating approximately a 3-month time frame for final review and approval of your product. So again, it's very important that you're following part 4, you've determined the appropriate application with the appropriate activity, you then follow both the form and the guideline, and complete your application, make sure all the requirements, and then you submit, and all going well, the Ministry of Health will get back to you with your review and approval, assuming you meet all the requirements within 3 months. A little bit more on the actual requirements themselves. I suppose the cornerstone of a lot of this is fulfillment of these eligibility requirements, and it's very prescriptive. I won't navigate back out in the interest of time to the Ministry of Health website, but all the information is there. Very, very specific requirements around the individual or the entity, the actual who's, shareholders, directors, etc. There is a legal obligation for all those entities being listed in these applications, and there are consequences associated with engaging in these types of activities if you don't meet the eligibility requirements. There are police checks. You are vetted to confirm that you are eligible, and so it's a fairly comprehensive process, but it's very achievable, and a lot of applicants are having success. So make sure that that part is all those requirements are met. Another part of the requirements is making sure that the actual fees are paid. At the time of submitting your license application, there's no requirement, to the best of my knowledge, to submit a fee with your application. Typically what happens is that there's an initial check of your application done in the first couple of weeks. And then if you pass that initial hurdle, the Ministry of Health will invoice you. To complete that initial check is approximately, I think, about $300, $350. And then depending on the actual application you're submitting for, the actual activity, it varies significantly. So for example, if you're requesting an assessment on a finished product under that supply activity, it can go $6,000 per application. If you're looking for cultivation activity, I believe it's in the range of about $5,550 maybe, $5,500 to do a cultivation activity. And again, all this information is very clearly spelled out on the website. I think an important note as well is that part of the application is that it's assessment, and that's typically done within the 3-month time frame. And then an inspection, and as part of meeting your eligibility requirements, you actually have to host the Ministry of Health and Medicinal Cannabis Agency on site at your location that you specified in your application, and they will conduct an inspection. And I did think it was important enough to share this information that, yeah, they'll do a paper review, a paper assessment, and then they actually come on site to actually confirm that your site is in fact meeting all the requirements that you're claiming to be in your application. And that's an important thing to note. When you complete an application and you say you're completing an application, everything in that application is going to be subject to inspection. So make sure that what you're actually documenting in your application is in fact what is at the time of inspection or at the time of submission, knowing that you have a couple of months to get everything in place before the inspectors arrive there, but make sure that that timing is well planned for. An additional part of their inspection, the cornerstone of their inspection, is actually confirming that there are adequate security arrangements as well. And they will contact you at least 1 month in advance of the inspection to schedule. And the last but not least, as part of the review process, there is, and I thought it was important to note that there is a process that if you disagree with the outcome, there is an appeals process. And again, this information is on the website, and it's good to know that it exists. And if you do have to go down that pathway for some reason, there is an option to do so. I think that's it. Just in the interest of time, I'll leave it there. If you do need to contact me, please feel free to email me or give me a ring at your convenience.
Great stuff. Thank you, Tara, and thank you for taking us to the Ministry of Health website. That was great because, of course, there's just so much information on there, and a very valid point about keeping abreast of it as well, because it does change quite regularly. As you say, in the interest of time, we'll jump straight to Mark, and then we'll come back to our questions after Mark's presentation. So, Mark, if I could encourage you to come online. There we go.
Good morning, everybody. Thanks, Tara, Manu, and Richard. Thanks for the opportunity to have a talk today. Hopefully provide a bit of information. So I'd like to start off with, I'll share my screen here. Okay, can we see that, Richard? Can you see that screen come up, Richard?
Yes, that's come up now, Mark. Thank you.
Okay, good as gold. So, yeah, I'd just like to give you a little bit of an overview about Cannasouth, just to get a little bit of context to some of the other things I'll be talking about at the end of this brief presentation. So, Cannasouth is New Zealand's only NZX-listed medicinal cannabis company. We are currently setting ourselves up to be a fully vertically integrated company, which essentially means that we'll be doing everything from cultivation right through to manufacture and sale of finished products and medicines. So this is just a bit of an overview of our sort of company structure. So you'll see Cannasouth at the top there, that's the NZX listed company. Cannasouth Plant Research is the entity that is developing medicines, formulating products, and selling those products and ingredients to, will be to New Zealand and export markets, hopefully. In the middle, you'll see Cannasouth Cultivation. That's our joint venture partnership. So Cannasouth Cultivation will be responsible for producing our main supply of medicinal cannabis biomass for our medicine manufacture. But they'll also be responsible for building a growers network where we connect with other growers in the industry to help us sort of build a robust and scalable supply chain. And then on the right-hand side, you'll see Midwest Pharmaceutics. So essentially another company that we've invested in that will be producing, manufacturing our medicines and ultimately stocking and distributing those for us. Midwest will also, through the Cannasouth Group, be undertaking toll extraction services for others in the industry. And this will enable companies that don't have those capabilities to ultimately further refine their products for sale. So I guess, you know, a lot of the people, certainly from, you know, that we're in contact with from the from the industrial hemp side of the sector are interested in what the opportunities are for, cultivating medicinal cannabis. And so ultimately, you've got the option of supplying to a local manufacturer, such as Cannasouth or others that are setting themselves up. And there's also potentially export opportunities for cultivation as well. So ultimately, for those considering entering, certainly in the cultivation side of things, it's important that you've fully thought through your cultivation strategy. You know, we're contacted by many growers that are eager to enter the industry, and they're often ready to commit significant capital into the operation without fully understanding the risks and benefits of the different approaches. So, you know, as Tara was talking about in her presentation, you know, licensing is one part of it. But ultimately, once you've achieved your license, you know, you need to have, as in any other horticultural or agricultural activity, you really need to have a firm understanding of, you know, what the sector is, how you're going to operate, what your point of difference is, and what your competitive advantage is going to be. So, you know, I think the important thing to remember is this industry will play out over years, and that we should be ready to expect, you know, fluctuations in prices, potential for oversupply, at various stages, as we often see with new sectors. And so some of the approaches and considerations that you need to think about are, you know, for a start, you know, what type of cannabinoid are you're wanting to produce? Each has different requirements. CBD, for example, if you're cultivating an approved industrial hemp variety, even if it's being used for medicinal purposes, you'll still need a medicinal cannabis cultivation license. That will come with a lot less in the requirements of security. Anything with higher THC will come with, as Tara pointed out, much more significant security costs. Then you've got the actual cultivation style or techniques that you're going to be using. Just a few here. Indoor, you know, you've got hybrid sealed greenhouses, you've got traditional vented greenhouses, outdoor cultivation, both covered and uncovered. And each of these brings, you know, a different risk and reward, but ultimately most of them boil down to, you know, an equation of capital cost and cost of production versus quality and consistency. And so again, this needs to be very carefully thought through with what your target market is and where you're going to fit into the supply chain. So not something that should be rushed into. And you definitely would want to have an idea of where the industry is going in the coming years so that you can plan your strategy accordingly. And other key considerations, especially for outdoor cultivation, this is often the lowest cost of production, but you get the biggest variability in quality and consistency. And you also get a large amount of biomass that's produced and often ready in a short time window each year. And so all that biomass needs to be handled, dried, and, you know, carefully processed. And this brings its own challenges. So definitely a very careful strategy in regards to, you know, what exactly it is that you're going to grow and how you're going to grow it, I think is definitely a good place to start. And even this particular slide here, it's the last slide, but really probably it's one of the most important things to consider is your quality and regulatory strategy. You know, when I'm referring to quality here, I'm not talking about the quality of your finished product, the characteristics, etc. I'm talking about the protections and processes that you put in place to ensure consistent, uncontaminated product every time. So, you know, definitely put this at the top of the list. It's no use producing a product that you cannot sell because you do not meet the quality standards of potential customers, or you're unable to navigate, you know, the regulatory landscape accordingly. So I'd suggest, you know, talking to a consultant, some experts in these areas very early on in your development and your plans. Because although in some areas of the world CBD is largely unregulated, in some places you can buy it in gas stations and drinks, it's found in food, nutraceuticals and cosmetics. In New Zealand, even CBD does not fall into that category. It's a medicine here in New Zealand. And Cannasouth as a company is required to produce our products under GMP. And so, you know, GMP is a method of quality control, and it's a case of building quality into the product, not testing for it at the very end. So that requires us as a company, if we're engaging potential suppliers of biomass for our supply chain, to understand and fully vet that supplier to make sure that they have all the quality controls in place to make sure that, you know, that product is suitable for our medicine manufacture. So as a company, you know, if we are engaging the growers network, you know, we'll be required to validate particular suppliers. And this process will require reviewing all of the quality systems that a grower has in place to ensure that they meet our requirements. And, you know, often it will require a site visit, review of all quality documents. It's quite an invasive process, but it's a key for us to ensure that we can validate that supplier and enable them to supply material that meets our quality standards. Because in New Zealand, when biomass is being produced for medicine manufacture, the manufacturer sets the standard, but the standard that we have to meet is GMP. So it's you know, it's quite a high level. So that's very important to sort of understand GMP requirements. All exported medicinal cannabis is required to meet the minimum New Zealand quality standard. And there's significant regulatory hurdles in this area as well. So again, I think making sure you understand all of this before starting to invest significant capital in cultivation is definitely very, very important. Other export markets may require other quality requirements to enter their country, or potential customers will have their own quality standards. So again, engaging potential customers for biomass early, regulatory experts, I think is absolutely imperative to avoid wasting money or hitting a dead end. So there's no denying it's definitely an exciting time for the industry here in New Zealand. The quality standards that we have will mean that we will be able to be at the very top level of the industry around the world, but it's going to take a little while for companies to fully establish themselves here in New Zealand and meet these standards. So, you know, again, you know, if you're interested in supplying a company like Cannasouth, get in touch with us. We're interested to talk to you. And, you know, as I say, we're keen on making sure that people, you know, try and make the right choices and avoid, you know, some of the pitfalls of not having a clear strategy in mind. So that's my brief presentation. So thanks, Richard.
Thank you very much, Mark. And I'll just encourage the other participants to come back and join our panel discussion as well. Mark, some really wise words there. And of course, you know, doing it before you spend lots of money. What a great idea. Because, you know, forewarned is forearmed, and there is expertise in the room here in the New Zealand ecosystem around medicinal cannabis and industrial hemp. So knowing what you're in for is such an important thing. But I do echo your words around having such a world-class regulatory environment that, you know, was worked on over a number of years and took on board industry feedback and has created the situation where it will hold us in good stead going forward, because our medicinal products will be able to be exported and have the best possible quality, because that's one of the major issues, of course, with CBD products that are coming out overseas. So we'll just take a quick look at our questions. Thank you very much, Manu, who's actually answered them for us, for our readers, well, our attendees. But there was a couple around the MOH is clear that industrial. One question we had from Rob, are you intending to classify industrial hemp in with cannabis? And this is something that Mark has talked about as well. And Manu quite correctly has pointed out that the Ministry of Health wanted two completely separate approaches. So although you can grow low THC industrial hemp varieties, if you wanted to produce that for medical end use, it would have to be under a cultivation license under the Medicinal Cannabis Scheme, which is a hurdle as far as finance goes. But it's interesting to note about the security that you were saying, Mark. Now that's obviously around the rate of diversion. So if I was growing high THC, I would be likely, it would be more popular for somebody to try and steal that or some such thing. Is that the reasoning for that?
Yeah, absolutely. I think it's a risk-based approach. The THC is obviously the naughty. They want to keep off the black market. Nobody's really interested in stealing industrial hemp for the black market. So, at least they've shown some, proper risk-based approach there around trying to, even if they are making you have a medicinal cannabis license for industrial hemp, which obviously for some people is not the best outcome. But certainly being able to grow those lower THC varieties without the high security costs, just makes sense.
Yes, it does. And of course, if you're growing high THC, you don't want to walk out the door either. So your facility would naturally have those sort of measures in place, just as a normal commercial decision. And with regard to with cultivation, when you mentioned GAP, are we talking about Hort NZ's GAP model, or do we have to come up with something ourselves, or is that something that the individual cultivators will be looking into?
It's a bit of a work in progress, I think. What are your thoughts on that, Manu?
Yeah, the Hort NZ gap probably not. Yeah, needs to be adapted obviously for cannabis. So, and it does seem to be a fairly sort of self endorsing process from what I understand. So there's nothing in the regulations that require it. But as Mark said, some overseas jurisdictions may do so. You just need to be able to demonstrate that you have complied and that someone independent has verified that it is worthy of being accredited to that standard.
And it will be something that the hemp industry needs to look at as well. So if that was to go ahead, having some standardisation in that space may be of interest to some of our members as well. And it's the same as the breeding side. We're all interested in that breeding, and to make it, give a safe environment to the people that are representing the seeds or breeding the seeds. A bit of base level information would be quite useful, where we could register our genetics or our phenotypes and things. So some really good conversations going to be coming out of there, which will ultimately help the industry, I believe. So yeah, looking forward to picking those up. And thank you, Manu, as well, for mentioning that the MCC and NZHIA are collaborating on a couple of those issues currently around the CBD, and I'd really like to look into that whole workforce development, because it's such a, we can predict now in 2030, we're going to be talking to Nick Marsh's report on Friday this week, what the sort of scope and the scale of the industry is. So we've got to, identify where the needs are, and there's going to be a whole range of opportunities, because people don't know it yet, but they're going to become soil scientists and microbiologists and plant breeders just because they're interested in the product and getting their hands and feet on the ground. So there's some wonderful opportunities there. With regard to the type of license, Tara, you were mentioning around for the supply license, you would need that to import, but that would also cover you for exports, assuming that you can meet all the requirements that Mark was mentioning.
Well, for exporting out of New Zealand.
Yes.
So typically there has to be some sort of arrangement or some sort of, and maybe Mark and or Manu could speak to this, that the importing country has to connect with the exporter in order to be able to have that license issued. So there would be, you only need an export license if it's non-CBD, if it's greater than 2% THC. That's my understanding, but I haven't actually physically done one yet. But maybe Manu, do you have any experience yet with the export piece? Anybody?
So the supply activity on your license would be required, and you still also need an export permit per consignment.
Yep, per consignment.
Not a license as such, but a permit, which is it's fairly straightforward. But as Tara said, that requires cooperation between basically the two state parties. The two governments have to both provide the evidence that it's acceptable for them to import and export. And
that lead time can be a little long too. So we just have to that has to be navigated quite carefully. Sorry, Mark, what were you going to say?
And then there's a product assessment for that export product as well. Is that correct? So that's where you know, that product is assessed. It needs to be shown that it meets the New Zealand minimum quality standard. So that's right.
That's if we're importing, right? If we're importing.
Yeah, the export product still has to meet the New Zealand quality standard as well, doesn't it? So so all of these little barriers and hurdles are going to need to be jumped through one by one as the industry gets going. So it's definitely going to be, and this is where, you know, my point too of really taking the time to try and understand that regulatory environment. There's no point setting up a whole business and then finding out that you can't actually export to your customer.
Yeah, understanding what the regulatory environment to where you're sending. If you want to export raw flower or something to Germany, you know, they have the highest level of quality, you know, GAP, GACP, and again, you know, all that accreditation needs to be obtained and evidence. And with COVID-19, I'm not sure the Germans will be. I'm sure they'll come this way, but I'm not sure anyone will be traveling. But we're just trying to navigate that a little bit too. How do we actually, you know, get over that line, you know, to actually be able to export flower? So there are some discussions with some of these major regulatory agencies about doing remote inspections and leaning into local regulatory agencies to be their eyes and ears. I'm not sure what role the Ministry of Health is actually playing in that at the moment. Maybe that's something the council could potentially field. I think it might be an agenda item for an upcoming meeting about how to handle virtual inspections potentially, to try to get our export market up and running. If it's, you know, it's sort of at infancy at this point, but that would be an important achievement for the sector to be able to lean into New Zealand Ministry of Health regulations and standards to be able to export into those major markets.
I think for us as a company, being involved in the New Zealand Medical Cannabis Council has been, you know, really a great thing. And so I'd encourage anyone that is serious about, you know, getting into the sector to look at joining up, because, you know, we do need to work together as an industry to confront these various barriers one by one. As Manu pointed out, New Zealand's a particularly small market, so really, you know, the best that we can do is get together as an industry and, you know, create those export opportunities and you know, operate to the various highest levels, and then there'll be, you know, plenty of opportunities right through the value chain for, you know, for many companies, and, you know, hopefully to employ a lot of New Zealanders in what will be challenging times over the next few years, sort of post-COVID.
So very, very astute comments. And I think, you know, the case-by-case nature of some of these overseas jurisdictions means that you're going to be constantly confronting these. So it makes sense to have those best practices in place.
Yeah. It gets even more complicated in a place like Germany, where each regional authority has autonomy and gets to decide on their own rules. So it depends on where your partner is based and who you're dealing with there. So, you know, let alone the EU sort of level, and then you've got the German federal level, and then you've got the regional authority.
Gets a bit crazy, doesn't it?
Yeah, that's why a lot of people in the world are looking to New Zealand to see what we're doing. You know, we've had the Industrial Hemp Regulations 2006, the Medicinal Cannabis Scheme coming in 2018-19, licenses available in April this year. The referendum coming up. It's really interesting for the worldwide community because we don't have those states structured. We just have one legislative arrangement. So presumably we could get things done. But again, it comes down to political will. I mean, we touched on CBD momentarily there, and you know, they've done as sort of much as they can because they've mistakenly, in my opinion, captured it as a medicine, which has complicated the whole situation. So, you know, it needs people to start voting with their feet and supporting the industry, and then it can move forward. Because as you said, Mark, I mean, there's a lot happening in Australia in this space as well, you know, which we'll be watching with eager anticipation. I'm sure the MCC will be watching what happens with the UN later this year. Do you want to take us on a trip down memory lane as far as the WHO there, Manu, or have you got time for that?
It's very complicated. I'm trying to sort of remember so the WHO recommended that a range of things happen with the classifications of THC and CBD, and a UN committee now usually takes the lead of the WHO on these things, but in this case, there's a number of very conservative state parties that are pushing back on any form of liberalisation around CBD or THC. So it's going to be interesting. Yeah, and so they are considering that again at the UN committee that does that. And I guess what we can do is try and bump it up the priority list for New Zealand representatives to take a lead there and really push it. They've sort of, as I say, in March, the representative, but basically said our rules internationally are outdated. We need to change them, and we need them to keep pushing. But yeah, some big countries like China and Russia, particularly, are pushing hard back the other way. And yeah, the majority of countries are very conservative on it. And there's a lot of terrible things that are done in the name of the war on drugs to individuals around human rights and also just public health issues that mean people don't have access to what is a largely benign substance. So yeah, it'd be great if again, New Zealand's got a reputation for leading on some of those human rights issues and on the world stage, and this could be one that the current government rolls over, or particularly if New Zealand First doesn't make it back in. I think there'll be a more progressive approach to some of these drug issues, and we can see some more rapid change at a domestic as well as at a international level, sort of pushing along there. So wait and see what happens next month.
Yep, next month. And so the election now, the referendum, again topical, and then the UN. I mean, it's been up on their agenda for the last two meetings, so they can't sit on it for too long. But as you say, some powerful people in some large countries that are just a little confused around what they're wanting to achieve, which would be, in effect, what America's done in taking industrial hemp out of being a controlled substance and also moving CBD out of that, which would save a lot of hassle, because they've got the same problem. They've at the FDA level put CBD in as a prescription medicine because of Epidiolex. So it's just sort of got stopped right at that very high level. And I think it was interesting what you were saying, Manu, around the Natural Health Products Bill, the Medicines Act and their Therapeutics Bill. Is there any word amongst the panellists around any of that, the timing of any of those things? Or I guess we've got to wait to see who the next team is post-September.
Yeah, I don't think anyone's expecting any announcements around that stuff before the election. But the Ministry of Health are certainly progressing. They know that the Medicines Act needs to be updated, and so work has been started on that. And likewise, I understand they've started re-looking at the natural health products legislation. So that work is carrying on regardless of who's in power, in a sense, because those things need to happen. And so I think, yeah, we'll see something next year. But particularly the Medicines Act update, overhaul, replacement, essentially is, that's a 3-year project from the start, from this year perhaps, yeah, it's going to be a long process.
The rollout, yeah.
But this would be where it becomes interesting if the referendum gets a solid yes vote, in the sense of, okay, you've got now a cannabis bill. I'm sure we're waiting on the feedback from our members before we enter the conversation. We need our members to acknowledge whether we should enter the conversation. If we do, it will be to broaden the conversation around, hey, it's not just about adult use or recreational use. It's about the medicinal cannabis. It's about industrial hemp. It's a vote for the industry, in effect. And because we'll be straight in there as far as the new cannabis bill goes. Okay, get us, if you're going to define what your problem is, which is controlling THC, then let's get low THC industrial hemp right into the arable industry. Why do we even need a license? So some wonderful conversations coming out of that could streamline that process, because MODA, similarly with the Medicines Act, was such a massive task to review that. But 1975, Medicines Act 1981, it's time to do something in this space. I just wanted to touch on the other two questions that we had. One was confirming that the cannabis licenses are annual fees. That's the same as our hemp licenses, but we can extend ours. I'm not sure if there's any provision in the medicinal ones to roll over or renew.
Yeah, I'm not sure where they got to, but there was some pushback from applicants who were, particularly investors actually, who kind of were nervous about only having 1 year worth of, legal operations before they had to reapply. And the ministry said it will roll over, in the sense that as long as you keep paying your fee and you keep passing your audit, but it'll still be an annual audit that fee covers.
Right.
So I don't think there's any automatic extension option at this stage. I think they were talking about once things are bedded down a bit like hemp, then those sort of options could be explored.
Yes, because we would like to see that as well. I mean, it's a similar sort of commercial reality. You know, if you're going to put it into rotation, or set up a facility, you're not going to do it for a year. So why not have those ones for, for longer? In our case, actually, the general license that covers a processing facility is issued straight away for 3 years. So that's, in recognition of that. The other question was, does a beverage manufacturer need its own license to work on cannabis-infused drinks? Or can they coordinate with another entity in such a way that a license for the beverage manufacturer is not required? Tomorrow we'll be talking with Samantha Gray from Bioequitas around some of the things we can do regarding hemp seed foods in this sort of food and beverage space. As far as it goes here, in the sense of medical, well, then there is no probably space for drinks as medicines in that space. Manu, do you want to just touch on that?
Just remembering back to a conversation I had with someone around medicinal ice cream. That could be a product someone develops for hospital patients who, but yeah, it's I haven't heard of anyone focusing on medicinal beverages at this point. It may be happening, but seems unlikely at this point in time.
Okay, but is there anything in the legislation around how people can take their medicine?
There's some stuff around you can't have injectables. And
so yeah, it's pharmacopoeia, it has to follow the pharmacopoeia dosage form. And you're absolutely right, Manu, with the exception of injectables. Yeah, so it's all in the regulation. It's fun reading.
Okay, very good.
Dosage forms, pills, drops, oral solutions, suspensions, all of that sort of very, very prescribed.
As you would expect in the medicinal industry, and that's back to the good manufacturing practices that everybody has to abide by. We've come up to the 12 o'clock, so I'd just like to offer the panelists if there's anything that you'd like to share with us as we complete our session today on medicinal cannabis.
Just from my perspective, as I say, we're keen to engage with the industry. So, if you've got questions, reach out. We're always happy to help wherever we can. And again, just encourage people to, we're members of both the NZHIA and the NZMCC. So, join up to some of these industry groups and try and, collaborate and work together and try and solve problems as a group,
And that collaboration, I mean, it's still strong in the beginning of this new embryonic industry, this emerging industry. So that if we can foster that collaboration, that's going to really give us some strength. Manu or Tara? Manu?
Yeah, I suppose I was just thinking too, if depending on what happens in October when we get the results of the referendum, there could be another arm to the cannabis industry, and we've talked about how are we going to work together across all of those areas. There's so many areas of commonality that we can cooperate on and collaborate around, and building that sort of New Zealand cannabis brand internationally is going to be critical for all of us. So let's keep doing what we can to foster that cooperation going forward.
Good.
And again, a good excuse for a good conversation, this pan-cannabis industry for New Zealand. And Tara?
Yeah, just to echo both Mark and Manu, it's collaboration, isn't it? The regulations have been put out, and we built the house and now we're living in it, as I mentioned earlier, and it's far from perfect, but it's at least we're pointing in a direction that's going to allow us to have a potentially very viable export market. As we've all acknowledged, the New Zealand market is quite small. We still want to deliver high quality products here at an affordable price point to address the public health need. At some point, these lower risk products will be down regulated. That's just going to happen. So in the meantime, for those players that are seriously wanting to go on this journey of medicinal cannabis, it's an exciting field to be in. I'm delighted to be in it. I have great people working in it, and collaborate. Reach out if you have any questions at all. I'd be happy to have a conversation and at least steer you in the right direction. Get everyone pointing in the right direction. We're all here to support each other.
It's about asking better questions, so a bit of information to help people to get to that point. And I think it'll be wonderful in the sense of infrastructure-wise. There'll be so many GMP facilities that our export industry is going to be par excellence, when we get going. It'll be great stuff. And all these people have got, GMP facility needs GMP qualified people. back to the training and employment potential. And
Yeah,
of course, these will be spread around the region. So, of course.
Yeah, that's absolutely huge. If there's anything, we've got to try to link into the academic institutions and create these programs to educate our young next generation coming through on not just the growing side, that's such an important part, but also this quality and compliance and regulatory piece. I'm doing a couple of courses at Auckland University in other sectors, medical device, pharmaceutical drug, but I'd love to be active in the cannabis side too, okay, how do we create the skill set that I'm working in? I know there's only a few of us, and it would be great to really open this up to the next generation. It's very exciting, and we're creating as we go. It's not that we're following rules. We actually can create as well. So just a vote for regulatory equality. Please, we need help. We need help.
And as a sector, that's right. I mean, we're employing more and more people. I'm sure Manu's the same. It's that type of industry. You need a lot of expertise on board. So, there's a lot of people losing jobs at the moment. And so it's great to be in a sector where we're trying to work back against that tide. So, as I said before, it's really exciting.
Awesome. Right, well, on such an exciting note, we should leave it there. I'm just going to thank our panellists this morning, Tara Creaven, Manu, Caddie and Mark Lucas. Thank you very much, everybody, for coming on today, and look forward to continuing these conversations in May 2021 in Rotorua. So look forward to welcoming you all there again.
Thanks, Richard.
Excellent. Pleasure. Thank you. Have a good day.
Bye.
Bye-bye.